let me start this by saying that I don't care what you do with your life or what you put into your body. That's your choice. You're a grown man or woman. You can decide all of that on your own. I am doing this video because this is something that I wish someone had told me before I decided to not eat meat. I was completely unaware of this information, had no clue about it. And if I knew this, I don't know if it would have changed the decision that I made, because I was pretty militantly convinced that I didn't want to eat animals anymore. But it would have at the very least forced me to approach doing that much differently. I would have been under very close doctor supervision if I knew this is what I was doing to myself. So, this is from the Cleveland Clinic, an article about pernicious anemia. Pernicious anemia is an autoimmune condition that prevents your body from absorbing vitamin B12. Left untreated, pernicious anemia can cause serious medical issues, including irreversible damage to your nervous system. Pernicious anemia, one of the causes of vitamin B12 deficiency, is an autoimmune condition that prevents your body from absorbing vitamin B12. Without adequate vitamin B12, you have fewer red blood cells carrying oxygen throughout your body. You can have pernicious anemia for several years before noticing changes in your body. Left untreated, pernicious anemia can cause serious medical issues, including irreversible damage to your nervous system. Healthcare providers treat pernicious anemia by prescribing B12 supplements. And hopefully you have immediately connected the dots here to understand that a vegan diet is giving yourself an autoimmune condition by choice. You are willingly choosing to give yourself what is otherwise classified as an autoimmune disorder. How does pernicious anemia affect my body? The term pernicious means harmful, and pernicious anemia causes harm to several body systems. Digestive system problems that cause nausea, bloating, and weight loss. Nervous system damage that causes muscle weakness, numbness or tingling in your hands and feet, memory loss, and dementia. Heart problems that can cause palpitations, feeling as your heart is beating too fast or skipping beats. Weakness and fatigue. Who is affected by pernicious anemia? Pernicious anemia typically affects people aged 60 to 80 of Northern European descent. Pernicious anemia is estimated to affect 151 in 100,000 people in the United States, so it's not a very common autoimmune condition. Symptoms and causes. What are pernicious anemia symptoms? Generally speaking, the longer you go without adequate vitamin B12, the more serious your symptoms are. Early on, people may have mild symptoms that they think are caused by common conditions. Examples include diarrhea or constipation, lightheadedness when standing up or with exertion, loss of appetite, pale skin, mild jaundice or yellowing of your eyes or skin, shortness of breath, mostly during exercise, heartburn, and swollen, red tongue, or bleeding gums. What are examples of pernicious anemia symptoms caused by long-term low vitamin B12 levels? Long-term low vitamin B12 levels caused by pernicious anemia can affect your nervous system. Symptoms of potential nervous system problems include confusion, short-term memory loss, depression, loss of balance, numbness and tingling in your hands and feet, problems concentrating, irritability, hallucinations, delusions, optic nerve degeneration that affects your eyesight. Can I have pernicious anemia without having symptoms? Yes. Normally, your body stores vitamin B12 that it gets from what you eat. Your body stores vitamin B12 slowly using it over time. It can take 3 to 5 years for your body to use up your vitamin B12 reserves. Now, that is very important to understand as it relates to a vegan diet. When all of these people are making their YouTube videos about how great they feel when they switch to a vegan diet, This is part of the reason why, because their body is surviving on their B12 stores that they built up as a meat eater prior to going vegan. And then on top of that, they're cutting out all kinds of processed food and just feeling much better, like anyone does when you cut out processed food. But it is not until many years later, when those stores of B12 start to run out, depending on your age and fitness level and just your genetics, how much you store, all things along those lines are nuanced and variable. But in general, after that, it can be several more years before you develop pernicious anemia symptoms. So think about what they're telling you here. You can go up to 5 years relying on the stores in your body, and maybe even more depending on how, again, your genetics are functioning and your particular makeup in storing B12. And then even after that 5 years, on the average, you can go several more years before your symptoms of the deficiency manifests. So we're talking, you could be on the long end of the average 10, 12 years into being a vegan and feeling great, quote unquote, having some minor symptoms here and there that were listed, but you just attribute that to getting older or, oh, my job or whatever, stress. Yeah, I'm noticing these little things, but yeah, that's no big deal. I still feel great. And you're still out there promoting your vegan diet to everybody, unaware that you are doing the exact same thing to your body willingly that other people are diagnosed with an autoimmune disorder for having going on. What causes pernicious anemia? Pernicious anemia is an autoimmune condition that happens when your immune system produces antibodies that attack cells in the mucosal lining of your stomach and nerve cells. Your immune system's response affects your body's ability to absorb vitamin B12. The antibodies also block a critical protein called intrinsic factor. Normally, intrinsic factor carries the vitamin B12 we get from food to special cells in your small intestine. From there, the vitamin B12 is transported into your bloodstream. Other proteins then carry the vitamin B12 to your bone marrow, where the vitamin is used to make new red blood cells. This process can't happen when your immune system blocks your intrinsic factor. In other words, there is some kind of immune system disorder going on in the body of someone with pernicious anemia that inhibits their ability to synthesize the B12 that they consume. So pernicious anemia affects people who eat meat and other animal products that contain B12. It's just their body can't absorb it properly, so it's a hidden deficiency that they're unaware of. And these people are in deep trouble a lot of the time because they go get checked out for these neurological symptoms, and the doctors can't figure out what's going on because they don't even think of B12 deficiency because the person isn't a vegan or a vegetarian. So you, as a vegan or a vegetarian, are willingly giving yourself an autoimmune condition by not giving yourself vitamin B12 in your diet to be absorbed and carry out all the very important functions that that vitamin carries out for you. That's something I wish I was told before I decided not to eat meat entirely, because, like I said, my whole approach would have changed if I knew that my moral objection to something was going to require significant attention and supervision from medical professionals to carry out correctly. And even if I carry it out correctly, I could get regular blood tests that show my B12 level is fine, but that's just the level in your blood. That doesn't mean that you're not deficient. You could be carrying a deficiency that's hidden just like pernicious anemia, even though your tests are coming back fine. That doesn't develop until many years down the line, where you've starved your body of what it needs, and then it collapses eventually, and you have all of these huge problems. You may also develop vitamin B12 deficiency if you have surgery to remove part or all of your stomach, which eliminates the cells that enable vitamin B12 absorption. About half of the people who have gastric bypass surgery to treat obesity lose cells that enable vitamin B12 absorption. So as a vegan, you are essentially giving your body the same conditions as someone who has gastric bypass surgery. A very major operation. part or all of your small intestine is surgically removed, reducing your small intestine's ability to absorb vitamin B12. Again, if you are a vegan, it's like removing part or all of your small intestine. You have the same results, in other words. In the case of removing your small intestine, you have removed your body's ability to process the B12 that you consume. In the case of being a vegan, you just remove the B12 from ever being put into your system in the first place. But the effect is the same. Hopefully this is starting to register what's really going on here. You have small intestine bacterial overgrowth. This happens when you have too many of the wrong kind of bacteria in your small intestine. This bacteria also uses up any vitamin B12 before your small intestine can absorb the vitamin. You take some medications, including antibiotics for infections and medicines for diabetes and seizures, which affect vitamin B12 levels. You have a tapeworm infection. You can get a tapeworm infection by eating infected fish that was undercooked. Tapeworms feed on vitamin B12. Well, what an ironic thing to be listed here, because, of course, as a vegan, you're not eating fish to expose yourself to potential tapeworms. You just decide in your infinite wisdom that, no, I'll just give myself the same symptoms that a tapeworm in me would produce. And I'll just do that willingly. Do you see what I'm saying here? Okay? And trust me, I understand, because I made the same decision that you did if you are a vegan listening to this. I get it. You follow a vegan or a vegetarian diet that doesn't include enough vitamin B12. You have medical conditions that affect your digestive system, like celiac disease or Crohn's disease, that make it hard for your body to absorb enough vitamin B12. You have endocrine autoimmune diseases such as hypoparathyroidism and Graves' disease that increase your risk for developing pernicious anemia. And then they go through the diagnosis, all of the different blood tests that you can do, which, if you suspect that you could have a vitamin B12 deficiency from being a vegan or a vegetarian, you would want to get the MMA test done in addition to the serum blood test, because these are a little more reliable than that serum blood test. Management and treatment. How is pernicious anemia treated? Since vitamin B12 absorption is blocked, your healthcare provider may prescribe intramuscular vitamin B12 injections. Later, after B12 stores are back to normal, they may prescribe high doses of oral B12 replacements. So to sum things up here, how do you treat all of these autoimmune disorders or tapeworm effects or having your entire stomach or small intestine removed and the B12 deficiency that results from that? Well, you supplement with shots or oral B12 pills or something along those lines. And what do they recommend that you do as a vegan as soon as you stop eating all animal products? Well, you get the same course of treatment, right? You take B12 shots or you take a B12 supplement, because you have given yourself an autoimmune disorder or some other kind of disorder that stops your stomach's ability to absorb B12. Again, do whatever you want with your body. A vegan diet can be a great cleanse for people that are really sick. I'm not saying it has no place. Just understand what you are doing to yourself when you decide to do this. I wish someone had told me this and made me aware of all the things that could go wrong when I was doing what I was doing, because like I said, I would have approached it much differently. But that's it for now. Later.